Welcome back to another episode of the Pressing Forward podcast. Today we have a special guest. He's worked with some of the biggest names in collegiate sports, traveled all over the world doing tremendous work. Sports psychologist Dr. Neff. I appreciate you being here, taking the time out to, not only share your wisdom, share your experiences and, basically help and just use this platform to help other people. So, how's everything going?
It's going well. It's going well. Thanks for inviting me to be on. Yeah, I really appreciate every opportunity to uh, you know chip away at the stigma around sports psychology and mental conditioning and mental health. So thank you.
Most definitely, most definitely. So usually how we start off is just giving the people, sort of a quick synopsis on who you are. So you're originally a Pottstown guy, local, okay?
Yep.
Um, can you really dive into, your upbringing and sort of how you got into the field that you're in now?
Yeah. So I mean, ever since I was a kid, I mean, my earliest childhood memory, and I sound like a clinical psychologist, is being out in the backyard with my dad, baseball hanging from the tree, taking cuts at the baseball, standing against the fence, and him firing balls at me. So just I grew up loving sports, and I played Little League baseball, Junior Legion baseball, Pee Wee football, middle school, high school football, you know, um, basketball from youth basketball to playing up through high school. So I always had this affinity and this draw and this love for sport, and even wrestled for a little bit. So tried it all. You know what you know got me into the field that I'm in now was being a student athlete that was um, yeah, recruited with potential of possibly making it to Major League Baseball. So in all three sports, I had received scholarship offers, and baseball was sort of my route that I thought was sort of the clearest route to potentially going pro. And um, I accepted a scholarship, went off to college. And what happened during that freshman year, so this is I graduated high school in 97 from Pottstown High School. um, so 1998, getting ready for spring training to head out to California as a pitcher. All of a sudden I couldn't throw the baseball. I was on the mound winding up, balls flying everywhere but the catcher's mitt. And 60 feet 6 inches is just, that's a number that's always going to sit with me, because I threw it for 10 plus years, that distance, the high velocity, and I couldn't hit the mitt. And for me, it was I didn't know what was going on. I was brought up in an environment where my parents were tough on me in a good way. They wanted to see me excel in the classroom, on the field, sort of make my dreams come true. And so I didn't mind being yelled at. I didn't mind being pushed. That facing that type of adversity didn't bother me. But I knew this time, when I was being yelled at, being pushed, it wasn't about my attitude, it wasn't about my effort, it wasn't about my skill level. Something else was wrong. And back in the mid to late 90s, mental health is, as much as we think it's stigmatized now, is very much stigmatized then. I had no understanding of how the mind and body work together, no understanding of, I don't think I ever heard the word anxiety or depression. um, and so it was, as I'm struggling, I'm feeling all these emotions that I never felt before.
Right.
um, you know coaches are saying, go get checked out. There's got to be something wrong with your arm. You can't hit the catcher. I'm thinking there's probably nothing wrong with my arm, but okay, sounds good. Hear all those typical sayings, suck it up, get over it, man up, toughen up. And my arm checked out okay, a little bit of inflammation, but nothing that would prevent me from throwing the ball.
Right.
And so come back the next day, can't hit the catcher, come back the next day, can't hit the catcher. And so I didn't know what to do. And I didn't get the guidances, this is to nobody's fault. It was just that it was that time, it was that era. Nobody sort of suggested to me to go and talk to somebody. Like maybe it's something that's psychological. How I came to find out that it was the yips was I had started. So I was either going to be a Major League Baseball player or be an orthopedic surgeon, sports orthopedic surgeon. And it was in my pre-med classes where I first learned how the mind works, where I first heard mental health, where I first heard the words anxiety, first learned about like the connection between mind and body in relation to performance. And that's when I sort of had that light bulb moment of, aha, I think putting so much pressure on myself to come in as a freshman baseball player with high hopes, high aspirations, that it's my own thoughts, it's my own anxiety that's interfering with my body's ability to perform. And so realizing then and coming to acceptance that I probably have anxiety, and that's what's interfering, sort of led me down this path of, unfortunately, like I ended up stepping away from baseball. Like it was too emotionally devastating to me to not be able to play. And so the things that I learned, it's part of our subconscious mind wants to keep us safe and protect us physically and emotionally. So things that I learned that I know now, I wish I would have known back then.
Mm-hmm.
So that I stepped away, and what I decided was the things I was learning about the brain, I wanted to kind of switch gears and become a different type of doctor, to chip away at the stigma around mental health, to provide education to student athletes at a younger age, to parents, to coaches, to athletic directors at a younger age about how the mind and body work, and why it's so important to pay attention to the emotional self as much as the physical self. And so, work with my athletic academic advisor, we sort of meshed together. I want to give up all the pre-med classes, so we meshed together pre-med and psych, because I thought that would give me the best well-rounded kind of foundation of going on and becoming a clinical psychologist, but specializing in working with athletes. So, as a clinical psychologist and sports psychologist. So,
and would you say that, not to cut you off, but would you say the background in terms of the biology helped you? Just, I guess, as like a foundation?
Yeah. So what I found early on was when I was approaching, like trying to get myself established, and be referred to, like I was going and just talking about like psychology and theory, and it's almost like taboo, right? And going and people automatically think like Sigmund Freud, and you're going to show my team ink blots, and
Yeah.
yeah, everybody on the team's going to walk out anxious rather than relieved or having a sense of education. So because so much time and effort, the way sports progressed and those early failures that I experienced, these early rejections, I said, well, let me sit back and rethink this. How can I reapproach this? And as I was saying, with so much emphasis on strengthening the body, so the strength and conditioning and skill work, you're creating that quote unquote muscle memory. essentially psychology. There's a lot of biology in psychology because the brain, I always say, is the most trainable muscle we have. Like all those neuronal pathways, we can train. We can sort of, the brain has so much plasticity that we can rewire it. And so when I started to explain psychology and mental conditioning in terms of all the biological aspects, um, that's when sort of the doors started to open for me, where coaches and parents and players were like, oh, this makes sense.
Right.
And it's where I sort of kind of coined the term like neck up training. Like,
Mm.
so one thing, my wife's sort of my best business
Business partner.
consultant, and you know, she said, we gotta sort of kind of work with the stigma a little bit, and to get something out of it, and um, to stay away from some of those sort of taboo terms early on of therapy and psychologist, and being looked at as a mental coach. Like, this is mental training, mental conditioning. Um, and then out of that, um, you know, there are some athletes that I work with that it's sort of, that's what they're looking for and that's what they need. And there is nothing going on clinically. Some athletes, there is stuff, that sort of services that is clinical. Because I always say we all have our own stuff. Um, we all come from different backgrounds, and we all have things in our lives that stress, things that may stress me out may not stress you out, or things
Definitely.
that stress you may not stress me out. And that's where the clinical psychology part is so important, to be able to form relationships, and have a pretty good understanding of what the person I'm working with has gone through in their lives. It's kind of shaped their view of the world, and shaped how they face adversity, and to be able to work with that, um, I think is very valuable. So yeah, I know it was a kind of long-winded answer, but yeah, the biology part is important in sort of laying the foundation and getting some of the interest, I guess, is the best way to put it.
Yeah, I think that's interesting as well, because you talk a lot about the connection between the mind and the body. I think oftentimes we tend to overlook the fact that much of who we are, how we operate, starts up here, starts up top. So that's the most important part of you know exceeding at anything in life, whether it be sports, athletics, whatever the case may be. And you talked a bit about the yips. I'm not sure if people are fully aware of what that was, and sort of, would you describe that more so as like performance anxiety? How would you describe that?
Sure. Yeah. So I would describe it as just very intense performance anxiety. So the yips with a baseball player is all of a sudden not being able to throw the baseball. A basketball player, all of a sudden, like, their shot is off, like, you know something that's so like rhythmic,
Okay.
so fluid. Baseball, just throwing the ball. There is this sort of intense fear that happens, that I like to say we got kind of like these sections of our brain. So we got our hind brain, which is all of our primitive instincts, our fight or flight system. Sort of that midbrain is our limbic system, all the emotions, and then our front brain is sort of all of our higher level thinking. And you know, when we get stuck in this hind brain, that part of the brain views everything as a threat. Because I didn't have the coping skills at the time to realize what was going on, or the awareness, I was stuck in this limbic, or this, not the limbic, but the hind brain, this fight or flight system. And so what my brain was sending me signals was, baseball essentially is the same thing as being out and facing a lion, tiger, or
In
bear
danger. In
in
danger.
danger.
Okay. Yeah.
So that part of the brain wants to keep you safe. This part of the brain is like, what's going on? So this tug of war sort of goes on. So so yeah, I mean, kind of back to your question, the yips is just, I think it's an intense performance anxiety slash like fear response.
Okay. Okay.
Yeah.
And that sort of ties into today's topic, which is perfectionism.
Mhm.
Anxiety is also tied into that as well. Can you explain, what perfectionism is and sort of how it shows itself within people?
Sure. Yeah. I see perfectionism quite often in my practice, and it's this idea where everything has to be like you got to go out and perform a 10 out of 10 every single time, or you know, if you're not outperforming at practice or in a game at a 10 out of 10, it's a failure. So I always say that like there's 9 common negative thought patterns we have, and one of them is sort of this all or nothing thinking, and that can, you know, I think, you know, that can happen at an early age with just sort of normal natural things that kids go through in development, like social comparisons, and now with social media, everybody's kind of putting their best out there, and then you know, I don't know, like I'm seeing it, and it's like, man, like I'm not as good. Like I gotta be better. Um, and I think what happens is athletes sometimes tend to do too much, and it just creates more frustration. The social comparisons create more frustration, and the athlete loses a sense of him or herself, and it gets stuck in this negative feedback loop, and the self-talk turns more self-deprecating and more negative, and this cycle of we have you know we say 120 to or we say 200 to 1,000 200 words per minute to ourselves, which comes to about 50 to 60,000 thoughts per day. I mean, that has a direct relationship with the emotional centers of the brain, which has a direct relationship with the physiology of the body. So when we're constantly thinking like we need to be perfect day in and day out, and everything we do on the field, on the court, in the pool, has to be a 10 out of 10, you know, we're actually starting to work against ourselves. And so um, that's where you start. From there is where I see anxiety arising, like performance anxiety, because when we think we got to be perfect day in and day out, our subconscious brain recognize we can't, like it's not possible
Mm.
to be at a 10 out of 10 every single day. So that fight or flight kicks in, that fear response kicks in, and kind of shuts us down because it doesn't want us to feel that negative emotion.
And I think that's very interesting because I've also found, well, even just from personal experiences, like sometimes, when you have that perfectionist sort of ideal, um, it's almost sometimes the more you achieve, the less you feel about yourself, the less good you feel about yourself.
Hmm. Hmm.
Um,
Yeah.
when does it actually become a problem? Because a lot of perfectionists, the thing is, they're trying to uphold to a certain standard. They're trying to exceed a certain standard. So when does it actually become excessive? Like, when does it become a problem?
Yeah. I mean, you threw out a great word, and that's something I look for, is that obsessiveness. So when an athlete is, you know, I know a lot of time and effort has to go into working in at your craft, but when it becomes at the forefront of your whole day is planned around like training, but for the reason of I gotta, like, I'm not as good as blah blah blah, I'm not as good as so and so. Where it becomes a problem is like what I look for is like changes in you know mood, changes in sleep patterns, changes in dreams, changes in eating habits, changes in social interactions. When sort of everyday functioning starts to suffer, and panic attacks set in, that's when it becomes a problem. Yeah, I agree. Like there's a certain level of drive of wanting to be, you know, good at what your craft and what you're trying to accomplish. But there's sort of this fine line of once it gets crossed, start to interfere with us emotionally, physically. And now we're just kind of working against ourselves because our body's breaking down, our mind's breaking down. We keep trying to push through things, push through these barriers, these hurdles, and again, the brain's like, what's going on? Like, stop, 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 stop. But this part of the brain is saying go, go, go. And so it's a matter of sitting down with the athlete. And what I like to do is look at performance more on a continuum. So like on a 1 to 10 scale, I like to break it down. So what does like 7 to 10 look like? Like, like what are the qualities within yourself that you can step away from the game, step away from the practice, and realize, okay, I'm in this 7 to 10, and we identify and we write those out. These are things that the athlete has with himself or herself, you know, in the locker, in their bag, in the notes section in their phone. Um, then we look at, so that, we want to sort of categorize that because the brain likes categories. Like, that's a good day. That's a good to great day. Then we look at like a 4 to 6. What does that look like? So, and that's an average to a good day. And then like 1 to 3 are those off days. And having athletes go through and being able to identify the goals, the attributes, the things that they're working on in those categories. As they're tracking it, they realize the perfectionism starts to drop, and they realize that they're not having as many bad days as they think, because our brain is 7 times more likely to go negative. It's just the way we're wired from a primitive standpoint. So what I'm trying to do is kind of pump the brakes on that, and have a more sort of reality, like a reality check of, a subjective reality check of what the day, what the practice looked like, what the game looked like. So, the player isn't walking out um, thinking that they were a failure. So kind of breaking that all or nothing type of thinking.
Yeah, I like that strategy. Just breaking it down for people. And you talk, a lot of what you talk about is the negative self-talk that people have, the conversation that's going on in your head. Because throughout the day, that's always, like you said, there's so many thoughts going out through your head. So being able to reframe those thoughts, I think that's an interesting way of trying to combat that sort of ideal. Um, One of the things I wanted to ask was, at times perfectionists or that ideal is also used like almost as like a shield. Like, what do you find that athletes or just individuals are sort of like shielding themselves from? What are they trying to protect themselves from?
Yeah, great question. I think a lot of it is identity,
Mm.
because growing up, athletes, well, most people take on some type of identity. And so, with athletes, it's a major part of who they are. And when you know, athletes get, there's a lot of recognition. Sports is a big business now, from the youth level through professional. Um, and so there's kind of coming up, there's positive reinforcement that goes on, which makes the athlete feel good about himself or herself. And so I think a lot of it is tied to identity. And when an athlete kind of goes from like high school, like standout high school player, and reaches the next level of college, that's where talent sort of kind of becomes on par. Like it sort of levels out. Now everybody's
Everybody's a
pretty much,
star. Yeah.
yeah, everybody's the star of their high school team coming in, and there's not too much from a physical standpoint that separates the the college athlete. And that's where, like, my talks with the high school athletes that are going into college, as far as like preparation, I do a lot of work on preparing, is the mental side. Like, how are you going to handle adversity? Because what's going to happen is your identity as the star athlete in high school and AAU and Yeah, you're no longer the star. I mean, there's always going to be that 1% that stands out, that
Yeah.
they're just, have those gifts. Um, but that identity, that strong identity of being the top athlete in the respective sport, you're up here now. Now you're down. Now you're with everybody else.
Yeah.
The
Yeah.
bar changed. The bar changes. Um, so I think that it's just preservation of identity and working with the athletes again on defining him or herself. You know, what this is where the clinical side comes in. It's like, what are you experiencing emotionally? What are those thoughts? Like, where is that coming from? And how do we, you know, how do we explore that? How do we reframe that? How do we get you to think differently? Because you know, to excel on the field, court, in the pool, we got to keep the mind as healthy and as clear as possible. So, yeah, I think what I've seen is a lot of sort of those that ding to identity and self-esteem. And then, because athletes were just competitive and
Right.
so we want to
Very
compete.
much.
So it's like, what do we know as athletes? Go out and work harder, train harder, and it just again reverts back. It can revert back to that negative feedback loop.
And that also ties into the idea of sometimes, less is more at the same time.
Mhm.
And just from what you've said, um, a lot of the times, I'm also interested because one of the questions I had in mind while you were speaking as well was how do you kind of see um, parental, I guess, standards playing into that? Because a lot of people's identity has been built up from childhood. Maybe their parents is telling them you're supposed to do this, you're supposed to do that, you're gonna be this, and that builds up a lot of pressure or anxiety to be something. So how do you kind of see those parental standards set upon someone playing into that perfectionist idea?
Yeah, another great question. I, what I see with parents is a lot of pressure being put on young athletes that aren't yet equipped with the coping skills. So emotionally, like the brain isn't kind of fully matured till about age 24, 25, somewhere within there. And the early messaging from coaches, from parents, I guess what I've seen more is a lot more criticism without the follow-up of teaching and providing some type of positive reinforcement. What a lot of studies show is you know, there aren't great long-term outcomes from punishment.
Mm.
So the yelling, the screaming, and I'm not against, I'm not against that at all. Um, but if there's the yelling, the screaming, it's got to be followed up with some type of instruction and reinforcement, because at an early age, the brain is so impressionable. It's still developing, and so there's the early messaging, at a you know 7, 8, 9, 10, even in the teenage years where teenagers seeking identity. Um, that early messaging can sit and have it can have a positive impact if parents, coaches, are coaching in a healthy manner, or it can have a negative impact and keep an athlete in a more negative fight or flight kind of state of mind. So state of mind. And I think too, the world now, social media, of seeing everybody posting the best of the best, and it's this messaging of having to specialize in one sport at 7 years old. There's a lot of burnout.
Mm.
You know, what is it, like 78? I don't quote me on this. It's around like 70, somewhere between 70 and 80% of athletes end up quit their sport. It's by age 13, and it's related to emotion, because they're just kind of getting this type of negative feedback all the time, and they just want to walk away from it. So I think, early on, and it's something that I too had to adjust, with the different generation of players that are coming up. I'm 43. There were things were different then
Right.
than now in 2022, and I had to adjust, to to learning how to best work with today's coach, today's parent, today's student athlete, to be most effective based on the experiences of what's going on in today's society, today's world.
Yeah, so you mentioned a lot there in terms of sort of the on social media playing an aspect into it. And then also parental standards being, sometimes parents can often, vicariously be living their dream through their child. And that kind of takes the love of the game away for the child. The child no longer really enjoys the game. They just feel like it's a job when, part of the game is to enjoy it. You're supposed to have fun playing the game. So what would be your advice to some of these parents, and how could they, like you said, there has to be some sort of positive reinforcement as well, some instruction to that. Are there anything else that parents could do in order to, help reframe the way they think about these things?
Yeah, great question. Number one thing I hear from the student athletes that sort of fall in this younger category is the impact that sort of yelling from the sidelines, like not allowing like the coach to coach,
Mm,
um, and the car ride, seems to be the
tough one.
the toughest thing for the younger student athlete. So you know what creates what changes behavior, what's been shown to change behavior, um, is reinforcing the things that went well, and then being able to have a healthy and kind of constructive and productive conversation on areas of growth. So again, our natural tendency is to point out everything that went wrong first, because that's sort of how we're wired. So for parents to be able to, you know, say, and you want to point out and reinforce like specific behaviors, not, you want to try and stay away from the more generic, oh, great game today, Rick, you really played well. Like identify two or three things, because what that's doing is setting the tone in the brain to be okay, it feels good, and now the student athlete can be more receptive to like some of the constructive feedback, and you want to approach it in a teaching like way. That's what I found is best with today's generations is, um, to sit down and teach. You got to be very careful with body language, because 70% of communication is body language. So if arms are flailing, and it's like, I see this a lot, like just the hands going, and
Yeah, yeah.
the messaging to the, like, whoever's seeing that is like, I'm done with you. And so again, the child isn't always equipped with the coping skills to be able to manage that, or block that out.
Still a child.
Yeah, still child, exactly. So you know, for parents, I'd say, positively reinforce the behaviors, things that are related to attitude, things that are related to effort, things that are related to focus, leadership, communication. Like those five things are always points that I hit on when I do like kind of parent clinics. Um, it's kind of circling back to the car ride. It's your son or daughter already knows that they didn't play well. And sort of the last thing that you want to do is get in the car, shut the door. And that's why, I hear from a lot of student athletes, it takes them so long to get their gear together, get out
Mm,
of the locker room, come out of the dugout, because they're fearing that car ride. So they already know they didn't play well, and allow for silence. Just allow for silence. And then it, depending on, like, with families, like we'll come up with time frames of when is the healthiest, given the dynamics of the family, when is the healthiest time to have a conversation. And again, you always want to lead off and positively reinforce the things that went well, and then introduce, just, hey, like, here's some areas that I think we can work on. So, and you want to pay attention to the context of the wording. Like, stay away from words of, like, you never play well when blah blah blah, or you always mess up when blah blah blah, because again, that subconscious brain really pays attention to the context of the wording. Um, we may think that it's positive. Um, we may think that it's motivational, but that subconscious brain registers it as a negative. And it, going back to what you said, I always say, ultimate emotion in sport, no matter if you're 7 years old or 70 years old, still playing sport is fun. And to be able to get an athlete to have fun, they're going to play his best or her best.
I think that's sound and tangible advice, because a lot of the times, if an athlete doesn't really feel like, or they feel like their love is dependent upon their performance. If they perform well, then my dad loves me. Or my mom, she extends that grace towards me. But if I don't perform well, then that all ties into self-esteem as well. So I think that's very huge that you brought that up.
Yeah, it's and I've heard that. Like, my mom and dad only think I'm a. They only see my mom and dad only see me as an athlete. Ask about other things, like do other things, like ask about school, ask about other hobbies. One thing I had to adjust to was never a big video gamer, but video games are here to stay. Like, how can we use that in a positive way? So that was a big adjustment for me. Um, so yeah, it's parents have and coaches have a huge impact on that early development of the player.
Um, and I just want to be cognizant of the time that we have left. So just to sort of, usually how I sort of wrap up the show and everything, just giving the listeners just your piece of advice, like one piece of advice that you would want to leave with the listeners.
Okay. So, yeah, I guess a piece of advice would be just what I hope everybody got from today was just an understanding of how important the mind is, the brain is, the emotions are to becoming the best version of oneself, and just kind of strongly encouraging parents, coaches, players, that are listening to this to not be afraid to seek the mental conditioning or the sports psychology or mental health side of their training, again, to become the best version of who they are. Because as you mentioned early in the show, I always say pure performance, it all starts in the brain. So our quads, our biceps, our triceps, our pecs, our abs have no memory cells, right? We often hear this term muscle memory. Rely on muscle memory, and what I always say, muscle memory is just a shot of confidence. It's just it's reassurance. Reassurance is your antidote to anxiety. And so when an athlete hears this, or a person hears just rely on muscle memory, it's like, okay, I got this. Which, if you hear yourself saying that self-talk, I got this, it relaxes us emotionally, relaxes us physiologically to allow us to perform better. Now, it's really not perfect. You're not going to get a perfect outcome every time, but it sets us up for a better possible outcome. So, not, I guess, not fearing the mental training, the mental health side, and everything that's going on these last what 3 years, 4 years with you know pandemic and social injustice and all that, and the things that kids see on social media, hear on the news, like even us as adults, has an impact on us emotionally. And I, the reason I went into psychology versus psychiatry was just the belief in talk therapy and being able to talk and express oneself and identify within oneself what are those stressors. You know, so pay attention to what you're feeling, but also the athlete that you're working with, whether it's your son or daughter, or as a coach, the athlete that you're coaching, what you know he or she may be experiencing, and don't be afraid to pull somebody aside and ask them if they're okay. Um, Emotions are scary, like I get it, because you don't know what's going to come out, but know then like where to refer, and where to refer somebody. So I guess that would sort of be my best um, piece of advice to wrap up the show.
Gotcha. And I love that message. In other words, what I got from that was don't be afraid to seek help.
Yeah.
Don't feel like, I think oftentimes it's stigmatized like, hey, if I go out and seek help, maybe I have this, I'll be diagnosed with a certain thing. But oftentimes, you're doing it for the betterment of yourself, not only as an athlete, but also your day to day. It allows you to get things off your mind and a lot more. So I love that message. And again, I appreciate you for, coming on the show, sharing knowledge. And, I wish you continued success in everything you have going on.
Yeah, thanks for having me. I look forward to staying connected. So thank you.
Most definitely.